Hello all, I'm Dr. Vaishali Valera. I'm the obstetrician and gynecologist and general practitioner talking to you from Australia. Today, I and Varsha, we are going to cover the topic of oral contraceptive pills, and I'll be giving the general information regarding them, and if Varsha has any questions, she's going to ask them so that we cover this topic fully. So, oral contraceptive pills are the pills which are obviously used for preventing pregnancy, like they're used for contraception. So, they came in market almost um, 60, 70 years ago, and that was a first female use contraceptive method which came in market and gave the freedom to women. The pregnancy changes women's life in every aspect, financially, physically, psychologically, and it's very very important that woman has a say or control of where when she wants to get pregnant. She should have that choice. So that is a great freedom the women got first time in life. So the oral contraceptive pills, as they suggest, they're taken orally, and there are different kinds of pills. One type has got two hormones, which are called as combined contraceptive pills, which has both hormones, estrogen and progesterone, and another type is only progesterone type pills. So, what combined oral contraceptive pills, which were the first type of pills came in market, what they do is that they suppress ovarian function. So, in short, what happens is that in normal menstrual cycle, on the day one of the period, the one of the egg in one of the ovaries start getting bigger, and over time, over roughly around 14 days, it ovulates. And after ovulation, then in next 2 weeks, either woman gets pregnant or she has her period. So before ovulation, there is one hormone which is called as estrogen, and after ovulation, there is one hormone which is called as progesterone. So what oral contraceptive pills has is that they have estrogen and progesterone both, and because they're given externally, then the ovaries don't produce the estrogen and progesterone. How does it that happen? Is that once a woman takes these pills, the brain receives a signal, and then brain thinks that these hormones are already there in the body, so the brain does not give a signal to the ovaries to produce these hormones, and then these hormones are not produced. That's why egg is not produced, and that's why pregnancy doesn't happen. So that is in simple language. So oral contraceptive pills are usually given for 20 days. Like there are 21 tablets which have got hormones, and then the 7 tablet have got sugar pills. So woman takes those tablets from day 1 to day 21, and then next 7 days she gets a period, and then the cycle repeats forever. These combined oral contraceptive pills can be taken either uh, like uh, taking the pills, active pills, which are 21 tablets, and then sugar pills, and then again repeated. But sometimes some women prefer skipping the period, so they can be taken then continuously. But if usually skipping of the period happens more than 3 months, then usually breakthrough bleeding happens. That means the irregular spotting or little bit of period or even normal period can happen with that. So that is combined oral contraceptive pills. The other type which I had said, these are progesterone containing pills. They have only progesterone, and how they work is that they cause the thickening of the mucus which is created by cervix, and then cervix gets blocked so that the sperms which are deposited in vagina cannot swim and go through the uterus through the tubes and meet the egg outside the tubes, and that's how they prevent. And they also cause thinning of the inner lining of the uterus, and that's why even if sometimes some of the sperm can break that thick cervical mucus, even they go and swim, and even if the egg is fertilized, that fertilized egg does not have good cushioning, thickened endometrium to form the pregnancy. That is another thing. And some of the progesterone containing pills to some extent can suppress the ovulation to some extent if the woman is breastfeeding or something like that. So these are the two different kinds of pills. Varsha, do you have any questions?
Yeah, so I want to ask, are there any disadvantages of taking these pills?
Yeah. So combined oral contraceptive pills and progesterone-containing pills all together, there are some contraindications. Like women who are having tendencies of clotting more easily, like some problem with their clotting systems, or some women who have had episodes of clotting in the legs, which has gone into lungs, which is called as pulmonary embolism. They should not be prescribed because these hormones, estrogen and progesterone, can cause thickening of the blood and makes women more prone for having clots easily. So that is one of the major contraindication. Also, the other contraindication, like a women who have had some kind of gynecological cancer or breast cancer, those who have severe heart disease, hypertension, or some strokes, like because of the high blood pressure, or some cardiovascular problem causing some strokes or brain problem, or those women who have focal migraine, these women should be very careful while taking those tablets. And these are the grossly contraindications of giving the pills.
Okay, do these pills cause weight gain or infertility?
So the oral contraceptive pills, there is no evidence that they cause weight gain, and they definitely do not cause infertility. So those women who have got problem with the fertility, the oral contraceptive pills are not going to correct them. So if they are going to take the oral contraceptive pills, once they stop it, those problems are going to return, and then they can have problem having pregnancy.
Are they safe for long-term use?
So, good question. So, anything which is given by medical faculties have got some side effect or consequences or risk. The oral contraceptive pills are also have very good effect if they are used for 3 to 5 years. They actually have a protective effect. There are studies which support saying that if the oral contraceptive pills, combined oral contraceptive pills, if they're taken for 3 to 5 years, they have protective effect for ovarian cancer. But if they are taken for a long time, like maybe 10 years, 12 years, there is evidence that it can mildly, slightly increase the risk of having some kinds of cancer like breast cancer or cervical cancers.
Okay, and what we can do if we miss a pill?
So, of course, when the pills are missed, then there is always a risk of pregnancy. So, if one pill is missed, then it should be taken as soon as the woman remembers it. If she remembers in 24 hours, then they should take the 2 pills. Usually, that is a protocol. Which kind of your pill you're taking, you need to talk to the pharmacist or with your GP and decide how they're to be taken. But if the pills are missed, then there is always a chance that a woman can get pregnant if the ovulation happens or the cervical mucus is thin. So they should use additional method of contraception in next few days.
So, are there any benefits of these pills other than not having kids? Like, for example, the period is regularized, or there is no pain during the period, something like that.
So there are a lot of other like good effects which the pills are used for. For example, suppression of ovarian function is good for short time for polycystic ovarian syndrome. That is one of the reason we actually give the pills for suppressing ovarian function, putting the ovaries to the sleep, so that when the pills are stopped, they can revert back to normal function.
I have a last question. Once you stop taking these pills, how soon you can get pregnant?
So ovarian function returns usually immediately. Of course, if the woman is having polycystic ovarian for which she had taken the oral contraceptive pills, then there is a chance that ovarian function does not return back to normal. But there can be, if a woman has taken it for a long time, more than 2 years, 3 years, or 5 years, there can be a lag of 4 to 6 weeks. But usually ovarian function returns quickly. I think we are going to stop here, and we will cover this topic more in future videos. If you have any questions, Please type any questions in your comment and we'll try to address them in future videos.